Hey you guys, what's going on everyone? Welcome to my channel. Welcome back to my tribe, you guys. We in 2021. We made it, you guys. Everybody made it out of 2020, hopefully safely. If you didn't, I'm sending nothing but positivity and love your way and hopes that you get better. So you guys, I just wanted to come and just share, you know, some information with you. If you're somebody out there that's considering going to surgical tech school, or if you're just looking for a little bit more information on the career, I'm just going to give it to you. If you don't know, my name is Canva, as I've already stated, and I've been a surgical tech for a couple of years now. I graduated in 2006 from surgical tech school in the military. And so, yeah, that's my, you know, stamp on why I am qualified to deliver this information to you. And I'm just gonna hop right in, you guys. So what I'm reading off of is going to be the surgical tech, the Association of Surgical Technologists job description. I want to just, you know, if you want to be a surgical tech, let me explain to you according to, you know, what one of our governing organizations say that surgical techs are. So when you go looking for this job, you already know, or when you're looking into the career, you'll kind of already know what you should know when you get the job, if that makes any sense. So what you'll be learning in school is going to be based off around the job description, right? So let's talk about it. I'm gonna read it straight from here. I'm gonna put it on the screen so you guys, if I don't link it in the description, at least you can see what I'm reading. So it says, surgical technologists are allied health professionals who are an integral part of the team of medical practitioners providing surgical care to patients. So surgical techs work under the supervision and regulatory authority of a surgeon to facilitate the safe and effective conduct of invasive and non-invasive surgical procedures, ensuring that the operating room environment is safe, that the equipment functions properly, and that operative procedures is conducted under the maximum patient safety. Did I say that right? Hold on, let me just back up. I don't want to mess up. And that the operative procedures is conducted under conditions that maximize patient safety. Excuse me. Surgical techs are experts in the theory and application of principles of asepsis and sterile technique to be combined with the knowledge of human anatomy, surgical procedures, and the implementation and tools and technologies to facilitate the physician's performance of invasive, therapeutic, and diagnostic procedures. So that was a mouthful, right, you guys? So just to kind of break down what they're saying, it's a person, right? You got a person. It's a person that has been trained on human anatomy, because it says here that the surgical techs are experts in the theory and application. So not only do you theorize it, you have to practice it. So you have to be able to apply what you've read. A lot of people can go to surgical tech school and they'll do great in the didactics and the clinical or the class part, but when they get into clinicals and stuff like that, they can't apply what they've learned. So not only do you need to be able to comprehend what you've been taught, you need to be able to apply it. So if you know this may be something that you struggle with, surgical tech may not be the field that you want to look into. We also speak on asepsis and sterile technique, and this is to minimize the infection that could come with having a surgical procedure. Surgical techs, I'm going to read this sentence to you, are experts in theory and application of the principles of asepsis and sterile technique to be combined with the knowledge of human anatomy. That's the first one part that you got to understand. Human anatomy, surgical procedures, implementations and tools. So that's the equipment that you're going to use to do the surgical procedures, right? And the tools, as well as technology, because you got to understand how to work some of the tools. You got cameras and stuff that get connected to light cords, and you know, it's stuff that have to be connected. So that's surgical technology. And this is all to facilitate the physician with the procedure that they're doing, to facilitate the physician's performance of invasive therapeutic and diagnostic procedures. So therapy meaning trying to treat, right? The treatment of, and diagnostic meaning to diagnose or to see. Like sometimes we might not we'll do a procedure and the procedure might not be to like fix something. It might just be to see what's going on, and maybe we can do a diagnostic, and then, you know, once you see what's going on, then you can go back and do the actual procedure. But the surgical tech's job is to be there to facilitate the physician's performance. You are there to help the physician. So you're looking at the level of understanding that you need to have if you want to be a surgical tech. You need to be able to communicate effectively and apply what you've learned as like your medical terminology has to be on point. Your human anatomy comprehension and understanding has to be on point. Surgical procedures, you have to understand these procedures. This is not something, and you got to understand like what each procedure is, and how what tools and equipment you're gonna need for each procedure. That's what the surgical tech job is. Sometimes you may get to a facility and they may not have a surgeon's preference card, which I know some of you may or may not know, but what that is. But a surgeon preference card is just like a recipe sheet. And if you don't have that, then you not only need to understand what the procedure is, but you have to understand it so you can know what tools and equipment and supplies to go get, because there is no recipe card, there is no surgeon preference sheet. You have to be able to read and comprehend and critical think. So if you're not good with critical thinking, this is not going to be something that is going to come easy to you. Being a surgical tech is not going to be something that's going to come, you know, easy. It's going to be hard, because you're going to have to be able to read, comprehend, and apply what you've learned in real life. And so you'll be in the operating room, and let's just say you're doing a hysterectomy for a woman, and you have no clue on the anatomy. So now not only can you not help with the case, now you don't really even know how, as far as the actual procedure go intraoperatively, but preoperatively you can't even go get the supplies that you need, because you don't really have a complete understanding of what part of the body you're on. Do I need candy canes? Do I need stirrups? What's the difference between the two? I know that might be a little bit advanced for some of you if you're just trying to figure out what this career is. But I just want to break down to you guys what it is that a surgical tech is. A lot of people you'll hear say surgical techs pass instruments, and it really does annoy most of us surgical techs, because we know that we do more than pass instruments, because we can't just you can pass all type of instruments all day, and that might not be the instrument that you need. You might be on the wrong part of the body for the specific instrument. So your understanding of your instruments and human anatomy, as well as the surgical procedure, all come into play when you're actually in the OR. So if you're somebody that's thinking that you're just going to be, the doctor's going to say scalpel, and you're going to get the hand of a scalpel or scissors or whatever they call it on TV, it doesn't really work like that. You actually have to know this stuff and be able to apply it in theory and in practice, right? And in logic. So I just wanted to share that with you guys. I hope this video was useful. If you are considering being a surgical tech, leave me a comment in the comment section below telling me why, you know, you think you could be a good surgical tech, and I'll respond to you. Okay, you guys, so that's all I have for you in this video. Please like, comment, share, subscribe, all that great YouTube stuff. Hit the, smash the like button, right? And I'll catch you guys on the next one. Bye, you guys.